Seminar. We are so happy to have you here today, and again, thank you for your flexibility and patience from this morning. This afternoon's speaker, we're just so honored to have him here. It's Jerry Sheehan, and he's the Deputy Director for the National Library of Medicine, where he shares responsibility with the Director for overall program development, program evaluation, policy formulation, direction, and coordination of all library activities. Excuse me. Sheehan joined the National Library of Medicine as Assistant Director for Policy Development in September 2006. In this position, he was responsible for monitoring, evaluating, and advising NLM officials on a broad range of science, technology, information, and health policy issues that affected the library. He also managed the Trans-NIH Biomedical Informatics Coordinating Committee and served as a key link to a variety of communities in the public and private sectors that develop and implement such policies. From September 2015 to January 2017, Mr. Sheehan was undetailed to the White House Office of Science and Technology Policy, where he served as Assistant Director for Scientific Data and Information and helped advance open science policies across the federal government. He has a wonderful resume and a breadth of experience, and I could stand here and read all day about Jerry Sheehan's fabulousness, but instead I'm going to turn the mic over to him, and so he can tell you more about open science. Thank you.
Okay, well, thank you all very much. It's actually a pleasure for me to be here at the SSP. I think it was about 2 years ago that I last had a presentation. I think it was a webinar with the Society for Scholarly Publishing on what was happening across the federal government in terms of open access, public access policies. I didn't have too many of my colleagues in the federal government at the time talking about open science, but that has changed a lot over the last couple of years. And I think for a workshop or an event that's on new directions, it seems like the new direction that I want to discuss with you relates to this concept of open science. And in doing so, of course, open science relates very much to opening access to literature and other kinds of research objects. And I'll give you an update on where we are at NLM and NIH, and to some extent across the federal government, the other federal research funding agencies, on public access to literature, and then some of the areas that we're beginning to think about, in particular at NIH, but also to some extent across other federal agencies that kind of advance this notion of open science. Now, some of you, I recognize some faces in the room, people who were at the Enphase event yesterday. If you were, you might just want to go outside and grab another bit of dessert, have a cup of coffee, and you can come back in about 25 minutes for the Q&A, and we can pick up from there, because I think a lot of the themes, and in fact a lot of the slides, are going to look very similar to you. I'll start off just by saying as well that as a representative and official, right, from the National Library of Medicine, to recognize that NLM, in the context of policy making and implementation in these areas of open science, often plays two roles. So one is we are a library. We have a charter to collect, organize, disseminate health-related, broadly defined health-related data and information. We are a library in that sense. We are also part of the National Institutes of Health. We are one of the 27 institutes and centers that comprise the National Institutes of Health, which of course is the major funding body for biomedical research in the US and abroad. We at NLM do fund research related to informatics, whether that's applying them to search and retrieval of the kinds of products and data we make available, or it's working with people who develop electronic health records and make use of the data in electronic health records. And so we often end up at NLM working with the rest of NIH on policy issues where we play an implementing role in hosting some of the infrastructure that supports it. And you'll see a bit of that as I go through my remarks today. I also work on a number of different interagency groups, and despite some of the what you may perceive from the outside about the federal government talking with many different heads and many different voices from different agencies, because we do all operate a little bit differently, we do have a number of mechanisms that we're using to help coordinate our activities, in particular around open science. If there's time at the end, I'll say a few words about what we're doing in that area. But I think there's also quite a bit of good convergence around this notion of open science, and its importance is something that all of the federal science funding agencies should be addressing. Okay. With that, let's see. I heard there were technical issues earlier today. All right. For the rest of today, it'll probably just be human error. So let me tell you where we are, coming back to this notion, starting with open science, right? The first piece of open science that we in the federal government have been working on relates to the published journal literature. So at NLM, we operate PubMed Central. I'm sure many of you know that, which is a repository for biomedical life sciences full-text literature. As of today, we have 4.5 million full-text journal articles in PubMed Central, fully searchable, freely available for retrieval and download and so forth. PubMed Central is populated both because of the NIH public access policy. If NIH funds you to do research, your article has to appear in PubMed Central, has to be available freely, not more than 12 months after the official date of publication. We also get a lot of content. In fact, the majority of the content in PubMed Central comes from journals. We have more than 2,000 journals that deposit all of their content with us on a regular basis. We have about 300 plus that provide us the NIH-funded content out of their journals. And we have about 4,000 journals that work with us to provide selected content. This is often an article for which somebody has paid an open access fee and they want to make accessible through as many mechanisms as possible, including ours. We're doing pretty well in terms of the compliance rate with the NIH public access policy, probably in the area of about 90% of the articles that we think ought to be in are in PubMed Central, and that's going back to when the policy first went in place in 2008. You can see on the slide that content and usage have grown quite dramatically. So the left side is the content, now up above 4.5 million articles. Usage has also been growing quite dramatically over time. The right-hand slide shows you how many, or chart, how many articles and how many unique visitors we have to PMC every day. And this is sort of a time period of 1 week in the middle of April. And so we're up at about 2.25 million unique visitors, sorry, more than 2 million who are downloading more than 2.25 million articles per day. Probably 2 or 3 years ago, maybe the last time I met with the society, those numbers were probably a little more than half that. But there's been significant growth, and we've seen this across all the systems we develop. As content grows, usage grows, downloads grow along those lines. And as best we can tell, the users of our systems are researchers, academic researchers in particular, but we see usage from industry. We see usage from educators and students, people who come from .edu accounts, and a lot of people who come from their internet service providers, which can be those same students, those same researchers when they're back home working at night or on the weekends, although you can see that things do drop off over the weekend. And it's also members of the general public who are finding this content relevant to health or biomedical issues that they or their own family members have. We have been working over the last year or so to kind of increase the utility of the content in PubMed Central. Right? It's full text content. We've been trying to make it available in formats, subsets of it available in formats that are easier for text mining and other sorts of data analysis tools, both to help people better find the content they need to solve their problem and to kind of sift through it to help identify connections, in particular helping researchers kind of make connections and glean the real knowledge that's in this corpus of text. We now have there's the open access subset of PubMed Central, which now totals about 1.7 million journal articles. And we have the manuscript collection. These are the author manuscripts that are submitted directly to PubMed Central, which now totals about 450,000 articles. So when you put those two subsets together, it's about 2.2 million articles. It's almost half of the content in PMC is now accessible for more bulk downloading, machine analysis, text retrieval, and other sorts of analytical tools that we hope is going to invigorate applications of machine learning and other kinds of tools to promote knowledge sharing. Knowledge sharing, dissemination, and analysis. We also, as you may know, we operate the PubMed system, which has abstracts, citations, and abstracts, now totaling about 27 million citations and abstracts there. About 6 million of those now, so about almost a quarter of the content, now has a link to a full-text, freely available journal article, whether it's from the publishers themselves or it's in PubMed Central. And that's a significant step forward in increasing the accessibility and the availability of the content that results from biomedical research, in particular, that research that we fund at NIH. Okay. As you're all probably aware, right, 2013, the Office of Science and Technology Policy told all of the federal agencies that fund more than $100 million in R&D a year to develop similar plans for providing public access to both publications resulting from their research and the data resulting from their research. And there are about 22 such agencies, all of which now, as of the end of last year, had developed their plans for providing public access to their the articles resulting from their research. And oops, I'm going to go back up one slide. No, okay, we'll stay on this one. So all 22 have their plans, and in fact, all 22 are moving quite quickly now toward implementation, turning a plan into a policy that says thou shalt, whether we fund you or whether you work for us, and then moving that into implementation. So as of a date of January 15th, 2017, anybody we fund needs to make sure that their article gets into the designated repository. So the 22 have done that. There are two other agencies that weren't even under the OSTP memo at the time who've also developed policies, essentially voluntarily, if you will. The Institute for Museum and Library Services, which is too small to have to be under the OSTP memo, and an organization called PCORI, the Patient-Centered Outcomes Research Institute, which is a non-federal organization that administers and provides R&D funding from federal funds. They have also developed policies for public access to literature. And I think so far the experience across the federal agencies has been that even though we are very different in terms of our research budgets, the fields we fund, how much is intramural versus extramural, do we use contracts, grants, do we have a library or not as part of our institution, but there's an ability for all of the agencies to meet some basic criteria for providing public access. And even though in the implementation, we haven't yet gotten to the point where we all use the same process and the same systems for doing it, we also haven't ended up at the point that we've got 22 completely different systems for doing this. The agencies that are listed on the slide in red are the 11 agencies, including NIH, that are making use of PubMed Central to provide public access to the journal articles resulting from their funded research. So there are now 10 of those additional agencies, all of the main HHS agencies, the FDA, the CDC, and others, as well as the Veterans Administration, and some others you might think of as having less biomedical or health-related content, but in the end actually have some health-related and biomedical content. NASA, NIST, the National Institute for Standards and Technology, right, and others as well. So this is providing, sometimes with their own portals, access into their related content in PubMed Central, or just a general search through PubMed Central. We'll start capturing and returning for you more of this kind of content. But as I said, this is sort of the tip of the iceberg, is making the journal articles accessible, right? We know the research process generates a lot of other content, a lot of other materials during the process, much of which gets summarized in the journal article, and we put a lot of emphasis on it, on the journal article itself. We're beginning to think about some of the other aspects, other parts of the iceberg, if you will, and trying to surface them as well and increase their accessibility for a range of different reasons. The first of these, and I'm not going in priority order, but the first of these I'll address relates to preprints or pre-publication versions of articles. I'm going to use a fairly loose definition of one, which is that it's a complete and public draft summary of a research project, typically written in the form of a journal article, and typically one that has been not yet been peer-reviewed, although it may be peer-reviewed. It may just have been peer-reviewed, but it's not yet been formally published. We know that there are many other funding organizations, you may have heard from some of them today, I know there are other funders in the room, who have been promoting the use of preprints and moving toward requirements for preprints in their areas. We know that within the life sciences area, if we look in PubMed, for example, only about 2% of the citations in PubMed appear, as best we can tell, to have an associated preprint that's available. Of course, all of them have a preprint or pre-publication version that is available, that was generated during the process. But there's growing recognition that preprints can, in particular, speed and accelerate the diffusion of knowledge from our scientific process. It does take a while to get from that first good, complete manuscript to getting a peer-reviewed, published version of an article. And in some cases, the timeliness has become of considerable interest in trying to shorten that time frame to access, recognizing that the articles are not necessarily complete and they're not yet peer-reviewed. Also an ability by having preprints to track the progress of the thinking and the scientific process over time, and they may even be advantageous, especially for young investigators who organizations like NIH are being encouraged to and are taking on themselves a particular interest in trying to promote young investigators in the research process, for many of whom their articles and their evidence of success may still be in the publication process somewhere. What we've been doing at NIH around preprints, and some of you may have seen this, has been taking something of a slower approach to it, allowing the experimentation, if you will, at preprints to continue out in the community, and trying to ensure that we're not getting in the way of preprints. And secondly, to help provide some guidance to how this process should evolve. So we announced back in March, and it took effect in May of this past year, that preprints, and actually the next topic I'll talk about too, study protocols, another so-called interim product of the research process, can now be included in progress reports, grant applications, other places where you might have cited or put a list of your publications. You can now include a preprint as well. So we're removing, in a sense, the bias in the system against other sorts of research objects in the process. But we've tried to set up a couple of I don't want to say requirements. We're encouraging and strongly encouraging and expecting certain conditions. So we want to ensure that these interim research products, for example, include a digital object identifier of some sort and indicate clearly that they are a preprint. What is the object? And providing information about the document version as it proceeds through the process. What we've done in the context of this is establish some expectations around preprints. If you want to include them on your progress report in your grant application, they have to sort of meet these conditions. So we want to ensure that the preprints themselves are publicly available, that they acknowledge NIH funding, that they clearly state that the work is or is not, in many cases, peer-reviewed. And of course, we want the usual things about declaring conflicts of interest, and we want to try to maximize their utility, their utilization. So we're encouraging broad licensing provisions with those, such as a CC BY license. We're also trying to give guidance to the research community if they want to follow this path. Where should they be putting these things? So we've come up with some encouragements about the types of repositories that we would encourage people to put preprints in to make them accessible. And essentially, these criteria here. We want repositories that will make them fair, findable, accessible, interoperable, and reusable, that have open metadata so that they're discoverable. Hopefully they're both machine accessible and human readable forms, so we can apply the same kinds of text mining and analytical tools we want to use for other types of text as well. And again, coming back to issues of versioning, linking to final published versions if and when available, and have some sort of a permanent archival plan. We don't want them to go that there should be a plan for this archive if and when it goes away. Robust archiving strategy. So that's been the approach taken so far. We know that, again, there's been quite a bit of activity. I mean, I think every week I see announcements about another preprint archive or server going up. We want to allow that to continue to happen and find ways that we can help ensure that the integrity of the process as it moves forward. The other thing we've been thinking about is another item. In fact, this guide notice, right, which is a way NIH communicates with its research community, referred to not just preprints or pre-publications, but it referred to broadly interim products. And the other interim product it refers to is the study protocol. Right? The study protocol, which is going to outline the purpose of the study, the method, the study design, the methodology, the analytical plan, maybe even the data collection methods and so forth, to provide a lot more detail than you're ever going to find in the methods section of either the pre-publication version or the final published version of an article, to help somebody understand what's being done or has been done in the research process. We see there being opportunities as well as challenges in making protocols available at different points in the research process. If you make it available early on, it can actually be a good signal to other researchers about, well, there's a project going on in this area to help reduce unnecessary duplication. And this can become particularly important in areas when you've got human subjects involved, right? When we may be testing new drug therapies on them. If somebody's testing one and we don't yet know the safety and efficacy, it might be nice if we weren't doing inadvertently another experiment on the same drug or other intervention at the same time. It can also provide a way of helping, how did I phrase it here, documenting the planned research activities so that you can kind of validate later when the published journal article comes out. Is it reporting on the same outcomes that they said they were going to study during the research process? And we know there are a few famous examples where that didn't happen, right? In the journal article that was published that showed tremendous and statistically significant findings, but that wasn't really what they said they were going to start it out doing. And it raises all the concerns, whether they're valid or not, about p-hacking and other sorts of fishing for good so-called statistical significance of results. And this can provide some way of tracking that process. There are also concerns, though, especially among the research community, about releasing this information too early, too soon, so they don't get scooped, so somebody else doesn't know what they're doing. And so discussion about making protocols available closer to the end of the research project, maybe when the results are disclosed, because with those they can help people interpret what was done in the study, understanding the methods, understanding the analytical procedures that were used, make better sense of the results as they are published. We have been at NIH most actively involved in protocol activity around clinical trials, where, as many of you probably know, we've had a clinicaltrials.gov system operated by the National Library of Medicine now for about 17 years. For the last roughly 10 years, there's been, under federal law, requirements for including results information in that clinicaltrials.gov for a certain subset of drug and device trials. The beginning of 2017 went into effect new regulations to implement that law, as well as an NIH policy that essentially took the regulations that apply to drug and device trials only, in later stage drug and device trials, and said essentially we're going to apply the same requirements across all the clinical trials that NIH funds, whether they're phase 1 studies, whether they're behavioral interventions that are not drugs and devices. And we're going to require them to be registered and report their results in clinicaltrials.gov. The registration, which occurs early on in the process, is essentially a summary of the study protocol. What are you doing? What are the interventions? What are you going to be measuring? What's the time frame? What we've done in the rulemaking is also said at the time the results are submitted, which is after the completion of the study, when you're providing summary results of the study, you also have to provide a copy of the full study protocol. That's typically the protocol that existed at the end of the study, and it would reflect changes and revisions that were made during the study process. That requirement just went into effect a few months ago for trials that are newly started. So of the 250,000 registered trials in clinicaltrials.gov, we have results now, summary results, for about a tenth of those, 25,000 of those, which actually is a pretty significant number. So in a way, we have a summary of the protocol of all of those 250,000 trials. We're now at the point that 172 trials, which is a pretty small number, but growing, have the full protocol available too. So you can go back and now see what was done in much more detail. Oops. Okay. The other big topic in terms of surfacing more of the research process and research outputs is, of course, data. There has been an activity across the federal government, federal agencies, and NIH has been involved in this area now for, in some regards, decades, trying to increase the accessibility of the data that are generated during funded research projects. We go back at NIH to 2003 when we put in place a data sharing plan, which said if we were giving you more than a certain amount of funding, you needed a plan for how you would share the data with other researchers, or tell us why you couldn't do it. Maybe it's because it was to confidentiality or other potential harms from sharing. We followed that up in 2006 with a policy that was related to genome-wide association studies, which was an area in which NIH was investing quite heavily at the time, and providing much more guidance about which data need to be shared, when does it need to be shared, who has access, under what conditions, taking into account, again, the confidentiality of the data. And NIH built, NLM built the repository dbGaP, the database of genotypes and phenotypes, to take that data. The success of that policy gave rise in 2014 to an expansion of that policy, which says anything NIH funds that generates genomic data needs to be registered in this DB gap, and it needs to have the data put in any one of a number of designated databases or another one that kind of meets the bill. That went into place in 2014. 2017, we put in the requirements about clinical trial data sharing, summary level data sharing. And many institutes and many programs within NIH have also established data sharing and data management requirements for their research, whether it's in autism, mental health, other areas, typically with an associated data repository. So essentially, we've gone from having a researcher tell us in their application what their plan is for sharing data, to in a few key areas, giving them the answers to the questions. What data should be made available? Where do you make it available? What are the rules under which and conditions under which other people can get access to it? The thing we're working on now is something called a new policy around data management and sharing. And this is responsive directly, got to hit the right button again, to the OSTP memo of 2013, which required agencies to develop plans, and NIH did, and we published it February of 2015, that met these criteria. Developed approaches for maximizing free access to the data resulting from funded research while taking into account all the considerations of cost and benefit of doing that, privacy, national security, other proprietary concerns, and in particular an implementation that says there should be a data management plan for any new research project, whether internal or external. The costs of data sharing should be an allowable cost. There's a cost of depositing in a repository, for example, or building some infrastructure. And I think most importantly, this notion of assuring the appropriate evaluation of a data management plan. So this is, again, a researcher telling NIH what it plans, he or she plans to do with the data from the study, both in terms of preserving the data and then how they're going to make it accessible to others, if possible, under these conditions. And we want that evaluated in the NIH view, and I would say that's a good thing to have not only the federal officials involved in, but your peers in the peer review process, who might know whether actually what you're doing kind of meets the community's existing expectations for data sharing or falls far short, or maybe it's way above. So this is what we're working on now, and I hope it's not going to be very much longer until there would be a version of this that would go out for public comment that'll lay out a few more of the details about essentially how we would meet these objectives. We, at the same time, and let me just say, a lot of other agencies, this is essentially the same 22 agencies, if they're listed in green or shown in green on here, they have this policy in place already across their intramural and extramural research portfolios. NIH is in a gray box down in the bottom left, meaning we have certain pieces in place, but we haven't yet got it comprehensively across our research portfolio. Those in the kind of the blue, the light blue and gray, we're still waiting to see their plans. Sorry, they have plans, they haven't moved it into policy yet. Okay, so we at NLM are sort of in an interesting point in time because we are getting near the end of a big strategic planning process, which has been ongoing over the course of the last 12, 14 months. And we're anticipating it will conclude by the end of this year with a new strategic plan for NLM. You may know that we at NLM, we have a relatively new director, Dr. Patricia Flatley-Brennan, who's both an engineer and a nurse and has worked in the medical informatics community for decades. And we have a new deputy director at NLM too, who used to work on policy there. We essentially, in a nutshell, and not surprisingly, given the interest in data across NIH and in the biomedical research community, big focus will be on what can NLM and what should NLM be doing in the area of data beyond those things that we're already doing, running clinicaltrials.gov, dbGaP, and these other services. And one way we like to think about it is what we can do as a library is do for data what we've done for the literature. We can do a better job of collecting, organizing, disseminating, and making it available through a full range of mechanisms. We've been kind of working on some of this ongoing, and some of this you're very familiar with, right? So we do have already mechanisms for linking to data from PubMed and PubMed citations, right? So we can put them in as a secondary source ID. We can link to other literature sources, which may be outside sources that summarize the data. We'd like to find even better ways to do this and make this more easier for people to find, make it easier for them to submit. And that's where I think a number of you can play a role in helping us collect those kinds of links to these other data sources. We're also working within PubMed Whoops. Human error, not technical error. Right. We're also working with, there we go, where was PubMed Central? All right, we're also working to provide greater means of linking data in PubMed Central. You've always been able to implement supplementary data sets. It's not always clear how to do it. It's not always easy for people to find the associated data sets in a PubMed Central article. We're trying to make both of those processes, again, easier. How can you submit data? How can we link to it in ways that will let people find out of a whole range of secondary resources and data citations? How can we let them find associated data more easily? We're even now within the NIH manuscript submission system, which is one route, right, is the route into PubMed Central, trying to provide an ability to upload supplemental materials, including associated data sets, up to about 2 gigabytes in size, and to provide links to external sources of data. And you'll see more of that, I think, in the system as it evolves, I think, just over coming months. So, ideally, what we would love to be able to develop, and I think us, other organizations, publishers, all the other intermediaries, are ways of interconnecting all of these digital research objects. And I didn't mention a number of them, but there are others. There are people, there's software, there are other instruments and organizations that we'd like to find a way to interconnect better through standard or well-agreed types of identifiers and linking systems, so that we can create new kinds of tools for discovery and new tools that allow multiple windows into this network. So yes, maybe I can find it from an article in a publisher website, maybe I can find it from PubMed, linking to these other resources, but I should be able to go into clinicaltrials.gov and find associated materials. I should go into dbGaP and find associated materials from that data. We've done this in some crude ways up to date. So you can go into PubMed and find a citation and link out to the full text version of the article. If you look through the article, whoops, you'll find, and maybe it didn't get highlighted in here, there should be, whoops, where did it go? One slide seems to have gotten lost. There it is. If you look in the abstract of the full text article, an NCT number at the end, that's the clinical trial clinicaltrials.gov identification number that we've worked with many journals and publishers to ensure appears in the abstract, so that we can automatically identify it, include it in a PubMed record, and include it in other places too. And in fact, it can be linked here. So you can click from the article, whoops, into clinicaltrials.gov record, where at the end, where we include related resources, and you can have a very sensitive clicker, right? We can link back to the article in the journal. And of course, you could imagine linking to other things as well. So I think this is the kind of interconnected network of objects we would like to try to develop at NLM and across the research enterprise, and with all of the partners that we can engage. We are working, as I mentioned earlier, internationally, and we're working internationally, and we're working across federal agencies to discuss how to move forward the open science agenda. So there is now an established interagency working group on open science. It's co-chaired by NIH and by the National Science Foundation, but has essentially all of those 22 agencies sitting around a table, both looking at ways to improve the implementation of things that they have been doing under that 2013 OSTP memo for publications and data, and starting to talk about these other areas of open science. What do we need to do? What should we be doing about protocols, preprints, software, data, and how do we move this forward? And this likes to go ahead too. So there's also a lot of international activity going on. I think I had 3 things on the slide that I'm not going to be able to get to. So both at the level of the G7, right? I think I had 3 things on the slide. The G7, the 7 largest economies, the G20, which includes a number of other emerging economies, including China, India, and others, and at the OECD, which has 34 member countries, typically high-income democratic countries, all of which have new activities ongoing related to open science. Last week was a meeting of the G7 science ministers. The U.S. was represented by the head of the National Science Foundation. And they essentially endorsed a report from a working group they had on open science that said, we need to work more as a group of countries on open science, and in particular, three things. One is sort of sharing information about our policies, practices, and implementation, how we're moving ahead in these areas. Second is looking at infrastructure and recognizing that at the national level, many countries are moving ahead with different types of infrastructure, cloud-based systems and others for scientific research data. Let's at least move in ways that don't keep us from collaborating well later, even if that's not building an integrated system. And the third is on issues of citation attribution, reward and recognition. How can we reward and encourage the research community and others to follow good open science behaviors and practices? Part of which I think has to do with issues around attribution and citation. Can we get the data citation, for example, to the same point as citation to publications, the way it's appreciated in the community, its availability as a metric, so that those who share data that generates other research and publications can get some credit for having done good data collection and having made it accessible. So those are some of the areas we're thinking about now. I think we recognize that this is going to take literally a village. It's going to take a whole community of people who touch the research process and the scholarly communications process from all sides. And we are looking forward to ways of engaging with all of them and with you to figure out how we move forward in open science. So I want to thank you for your attention. Thanks especially to those who listened to something similar to this yesterday. And I think we left some time for questions. So thank you very much. Stunned into silence.
So you had mentioned that you were going to talk a little more about some of the international partnerships and that you didn't really get a chance to talk about that. I wonder if you could address that.
So yeah, so I think those are happening at several different levels, right? So the ones I highlighted were kind of the big statements from big international groups, where I think the couple of areas of importance of those. One is the recognition, in some cases, not just among the leading kind of science representatives in those countries, that among all of the issues in science, that these notions of open science are important and are an area in which they should be collaborating further. And so the fact, too, that when this went to the G20 last year, that was not just the science people who were talking. Those were actually the heads of those 20 countries, right? Their presidents, their prime ministers, and others. And open science, again, appeared and featured among the issues that they were considering. They've had a lot of things to consider. So there's great significance in just having this recognized within those documents. At the working level, there are now some working groups in each of these organizations that I mentioned who are looking at what we can do in a collaborative way around open science. Some looking at models for sustainable data infrastructure. The OECD has some projects ongoing in that area. I think these questions of attribution and citation and so forth and recognition of the importance of sharing and openness and management are also getting a lot of discussion in those areas. And then there are, of course, across the 22 federal agencies and beyond, a lot of bilateral discussions with our other funding agencies and research institutions, across the planet now, for how we can collaborate and share and work better. So for example, at NLM, we do a lot of work with PubMed Central, with our European partners. Of course, a lot of our genomics databases are replicated, and we collaborate with partners in Asia and in Europe. And that type of work is ongoing. And there's a lot of engagement of federal agencies or individuals within them in something called the Research Data Alliance, or RDA, which is also kind of a community bottom-up driven process to say, where are there places where we can exert some leverage, come up with a solution, develop some protocols, whether it's about metadata in general, or it's about data standards in a very particular field of science that can help promote access, interoperability, and so forth with data.
But that standardization is difficult cross-culturally or internationally?
I think standardization is difficult even across a single organization. Yes. Right, and the old adage in the standards community is that standards are wonderful because there's so many of them to choose from, and I think getting agreement on them. Of course, we all have the ones we favor, we all have the ones we promote, we all have the ones that we built into our systems. And really, you want me to change the way I've been doing things? So, yeah, it's a very vexing problem, but I think it's one we probably all in the room agree that we should. If we had greater standardization or agreement on how to proceed in formatting some of this information, it would be much easier to share and interoperate. But it's going to take us a little time to get there. And I think trying to identify those places, though, where with some effort we can make a significant view, even if we're not doing it across the sciences, we're not boiling the ocean, right? But can we find those places where we can take a significant step forward and improve the ability to interoperate, and I'll use that in a very general sense, in a particular research domain, which can then demonstrate some of the challenges. The only other comment I would make on that is I think we're maybe at the a switching over point, because I think you appreciate the value of data standards and so forth when you have data that you can find and access, and then you realize that you can't make very good use of it. You can't combine it with other data sets. You don't really understand how it was collected and what the formats or the units or whatever are. And I think we're getting closer to that point where more people are realizing that I could make much better use of the data I can now find and access if it conformed to certain standards. And I think that will kind of provide a little bit more push for it, because those of us, NLM has been a big proponent of data standards and terminology standards. And sometimes you're pushing hard and moving as hard as you can, but there's not a lot of receptivity on the other end, because why should I adopt a standard? I'm not sharing my data. It's not accessible. I think that environment is changing, and the optimistic side of me says that that'll help kind of push things to a greater recognition and more activity around standards.
Thank you so much.
Great, thank you.